What are symptoms of adjustment disorders? So that's going to be your next question, right? What are the symptoms of adjustment disorders? Remember that, so symptoms of an adjustment disorder, again, they start within 3 months of the stressful event. That's key. And the symptoms you have, of course, are going to depend on which of the 6 types of adjustment disorders you might have. So it can be very different for different people. Because that's, obviously, I just said, oh, if you have depression, if you have anxiety, if you have, conduct, like these are all, these show up very differently. So the common factor is that you experience more stress than would generally be expected. You're again in response to whatever the stressor was. You're having an outsized reaction to whatever the initial stressor was, and it's within 3 months. Okay, so some examples: feel impulsive behavior, feeling sad, hopeless, or sometimes it's really not enjoying things you used to love. I call it a case of the mez. Like it's like meh, maybe you used to love to play piano. Maybe usually playing with your pet gave you so much great feeling, and suddenly those things are gone. Okay. Crying often or for quote unquote no reason. Like you'll just suddenly burst into tears somewhere when, the waiter at your restaurant says there's no, rolls. They don't have your favorite rolls, and you're suddenly crying hysterically. That could be that. Feeling nervous, tense, anxious, worrying, or stressed out like a lot. Feeling irritable or like you can't handle anything. It just, everything seems so hard. Having trouble sleeping is a common one. Loss of appetite, difficulty concentrating, or again, like you have trouble focusing. You have trouble figuring out even how to help yourself. You're just, everything's too hard. Trouble getting through your day and the things you have to do. So that might be, not being able to work or go to school, or sitting there and not taking notes or something in class, not paying your bills, not cleaning up your breakfast dishes, your personal hygiene might be affected. But for example, all of those are signs of depression also. So again, we're looking for the different kinds of things. Did something just happen and you're having this response? That's different, and how we treat it might be different than, if you've had a history of severe depression. Okay. So I'll be clear. Okay. Withdrawing from family or friends, isolating in some ways. And a biggie that does come up, which is horrifying, is thinking about suicide or acting on those thoughts. And that's probably the thing that worries me the most, because you're having outsized reactions, because this is not normal. You might, you might get a divorce and suddenly think of killing yourself. And sadly, because people are having these oversized reactions, this is the biggest risk factor that you'll actually follow through, because it's way more than is quote unquote normal for this, right? Do you see that? And you might act on that. And that's really scary. I know. Sit with that for a minute. Another thing to keep in mind is that your symptoms don't last longer than 6 months after the stressful event, as I said. Okay. So onset is within 3 months, and they don't last longer than 6 months. So that's right there a great way to tell if, it's a year after your mom died and you cannot pull yourself out of a depression. Guess what? You got something else going on, right? And your mom maybe was the triggering event for that, or exacerbated a condition you already have. Although I will say, let me say this. I'm going to sound like I'm contradicting myself. But this is psychology, and this is why it's good to be trained. You could have a lasting adjustment disorder for more than 6 months if the stressful event is ongoing. And this happens sometimes. So maybe, you lost your job 6 months ago or 8 months ago, but you still can't find another job. Guess what? That could last a little longer. I had something, it was a little bit ago now, maybe 6 months ago, where I had a client who was getting divorced. Her partner cheated, and they decided to divorce. It was really bad, but they couldn't afford to physically separate yet. So they were living in the same house, and it was very, very tense and horrible. And so my client felt triggered over and over by her partner's infidelity. And anyway, it was bad. And this client continued with this. So do you see what I mean? Like it could be something, God forbid you had, and this happens with teens and kids, maybe a grandfather fondled a granddaughter, let's say, but the grandfather's still around. So obviously, this would create other problems, right? And because it's ongoing. Okay. So, what are the causes or triggers for adjustment disorder? Everyone reacts a different way to stressors in their lives. We all have, again, different temperaments that we're born with, different learned emotional behaviors, and our genetics play a factor. So, the death of your mom might throw you into a tailspin, and meanwhile, your brother seems fine because we're all a little different in the same family. Some typical events that I see in my practice that might then show up as an adjustment disorder, that's what I can speak about, are divorce, and most of them I've just talked about, but divorce, cheating, or just really major problems with a relationship. Death of a loved one is a biggie where there's something there. A major life change, so retirement, being fired, being laid off, moving, right? A major life change. Divorce obviously could go in there, things like that, a major life change. The other thing I see is when finding out something physical, like having a chronic illness. I had a client recently who was diagnosed with rheumatoid arthritis, and she's very young. And if you don't know, rheumatoid arthritis is incredibly painful, incredibly difficult to treat in a lasting way. And she's 36. So she's looking at the rest of her life with chronic pain, and that she's going to be able to do less and less as her life moves on. I mean, it's horrifying diagnosis. Losing a pregnancy in whatever way. Learning your child has diabetes. I had that once with a client. I had another client whose partner had a heart attack, and there was an adjustment disorder afterwards. He became so nervous, so anxious about everything. He became almost paranoid, and because his husband was had this heart attack and almost died. Like he had to wear like the vest that like saves you, that you wear this vest because your heart's going to go at any minute. I mean, it was terrible. Anyway, being unable to get pregnant easily. I've had people have it from that. Any unexpected catastrophe. We've had a lot of fires here in California. I can't tell you how many clients I've had who have had a home burned down in the last 10 years. Something like that. Or I've had clients from other countries where there was, war or bombings or who knows what else, right? And some catastrophe. Which would really include also a catastrophe like a physical assault, violence of some kind, rape, obviously. And let's take rape. Someone who's raped might have PTSD, or they might have an adjustment disorder. It again depends on when the symptoms show, how long those show up, again, in the windows. And that's why you really have to think about the timing of all this with adjustment disorders. If adjustment disorders don't resolve, right? If they don't resolve, they can lead to even more, again, serious mental health conditions. So like major depression. I've seen drug and alcohol problems, drug and alcohol disorder develop. Again, suicidality that I mentioned before. I know. So what else could it be? I mentioned differential diagnosis earlier. Again, this is basically when we mental health professionals are presented with someone's symptoms, and we have to decide what it is we're looking at. And the most common way to misdiagnose is to think something is an adjustment disorder when there's actually a mood disorder, again, such as severe depression, when there was a pre-existing drug or alcohol disorder that just got exacerbated, an anxiety disorder, PTSD, obviously, right? Post-traumatic stress disorder. So the symptoms could be similar, but if you don't identify the real cause of those symptoms, and again, look at that time frame, you're going to focus on the wrong things. You're going to use ineffective treatment tools, and the person won't feel better. You won't feel better.